What if I told you there was a company that still hasn't recovered from the pandemic? This company has an FDA and CE approved product already. They have the financial backing of a global power, and their product is innovative in its field. That field is growing at an annual growth rate of over 10% per year. Wouldn't investing in this product just make sense? Hey everybody, Walrus here from Walrus Street, bringing you a DD today on Senseonics, ticker SENS. Before we begin, just a reminder, I am not a financial professional. All information in this video is for entertainment purposes only. Now, I gotta explain what happened here with SENS. On Thursday, pre-market, January 14th, I released a post on my community section of my YouTube channel. The reason I released that post is because I was planning on buying SENS before I could release this video. I looked at the chart looked like it was about to pop, so I wanted to make my purchase and get in. You guys know what happened. The rest of the day, SENS absolutely shot up, and Friday, even though Friday was a red day in the market, SENS actually held its value pretty strongly. About 10 hours after my community page post, Dr. Dean Investing made a video, and also my financial friend released a video. So if you are interested in learning about SENS, you can check out their videos after you finish this one, of course. I like to credit my viewers, but SENS didn't actually come directly from one of you guys, but I do want to say something else. Michael Hu recommended that I look into NMRD, which is Nimara Medical. They're creating a diabetes patch that you actually wear on your skin. While I was researching NMRD, I actually ended up stumbling across SENS, and I kind of just fell down the rabbit hole of Google, ended up doing a ton of research into SENS, and decided to do the video on that one instead of NMRD. Sorry, Michael, my bad. There's a lot to cover, so let's go ahead and get into it. This is their website. Senseonics is the company. Eversense is the product. Senseonics are the creators of the first and only long-term implantable CGM. This brings us a couple of questions. What does it treat? What is a CGM? And why is this guy so damn happy? CGMs are used to help in the treatment of diabetes. Diabetes is simply a disease that occurs when your blood glucose, also called blood sugar, is too high. Blood glucose is your main source of energy, and it comes from the food you eat. Insulin is a hormone that's made by the pancreas in your body. It helps glucose from food get into your cells, and it's used for energy. Sometimes your body doesn't make enough insulin or doesn't make any at all. Or maybe your body just doesn't use the insulin well. Glucose stays in your blood and doesn't reach your cells. Over time, having too much glucose in your blood can cause health problems. And there are two kinds of diabetes. There's type 1 diabetes, type 2 diabetes. With type 1 diabetes, your body doesn't make insulin at all. It's usually diagnosed in children and young adults, but it can be diagnosed at any time. Type 2 diabetes, your body doesn't make or use insulin well. You can develop type 2 at any age, even during childhood. This type of diabetes occurs most often in middle-aged and older people, and it's the most common type of diabetes. Let's look at the numbers. In 2018, 34.2 million Americans, 10.5% of the population, were diagnosed with diabetes. Now, of those 34 million, only 1.6 million were type 1, so the rest were type 2. That's how you know it's way more prevalent. Type 2 diabetes is reversible. There are several risk factors that contribute to type 2 diabetes, such as being overweight or having obesity, and we know that being overweight and being obese are rising trends worldwide, especially in first world countries with Western lifestyles. Over time, it stands to reason prevalence of diabetes will be increasing. Type 2 diabetes can be life-threatening, but if it's treated carefully, it can be managed or even reversed. Treatment for type 2 diabetes includes monitoring your blood sugar levels, using medications or insulin when needed, and also for management, eat a healthy, well-balanced diet, exercise, lose weight. Right here, this first one though, monitoring your blood sugar levels. This can be achieved through continuous glucose monitoring, CGM. Continuous glucose monitoring automatically tracks blood glucose levels, blood sugar, throughout the day and night. You can see your level anytime at a glance. You can review how it changes, and you can make informed decisions to change your food, activity, and balance your medicines. Now, most CGM works kind of in this way. It's got a tiny sensor inserted under your skin, usually in your belly or arm. They measure your interstitial glucose level, which is the glucose found in the fluid between the cells. CGMs are very effective. This is from the American Journal of Managed Care. Continuous glucose monitors, CGMs, are increasingly accessible and effective for patients with type 2 diabetes and even those with pre-diabetes as a means for real-time biofeedback and behavior change. So we know obesity is reversible, losing weight, managing your diet. Type 2 diabetes is reversible through the same ways, and a CGM helps people reverse that type 2 diabetes through personal management. This actually plays into the thesis of why I think SENS is a very good opportunity. Diabetes prevalence and socioeconomic status are linked. There's an increased prevalence of type 2 diabetes in economically deprived areas. This is a study back from 2000. We've known this for decades. Why do I bring that up? Because the most common health insurance in America is Medicare. Medicare also serves economically underprivileged people. So Medicare, actually covers Eversense, which is the Senseonics CGM management system. Healthcare providers can insert Eversense immediately in their clinic once a patient and healthcare provider agree that it's the right choice for them. After insertion, healthcare providers may bill Medicare directly with the existing CPT codes that include the cost of Eversense system and procedure time. Medicare is covering the procedure to insert the implant for Eversense, and it's going to be covering the physician time. Now, this market is massive. This is from Grandview Research. The continuous glucose monitoring device market is worth $10.4 billion by 2027. Obviously, it's lower today, but it is growing at an estimated growth rate of 12.7% over the forecast period. Growing cases of diabetes are anticipated to propel market growth with increased number of patients opting for simplified CGM devices. This growth is coming from the increased prevalence of diabetes led by obesity and type 2 diabetes. The Eversense from Senseonics does have competition, but it has an edge, and I'll explain why in a moment. Dexcom G6 is a CGM, and the way it works is it is inserted just into the skin. You mount it onto your skin, and there's a little needle that goes underneath your skin into the interstitial zone to monitor the blood glucose levels. Once it's on your body, you can track on your cell phone, but it's always going to be wedged into your skin, kind of anchored by the needle. The Abbott Freestyle Libre is another one, same exact concept. It has to be anchored into the body with a needle. The same thing with the Medtronic Guardian 3 system, has to be anchored into the body with a needle. The Dexcom has to be reinserted every 10 days. The Abbott Freestyle lasts for 14 days, and the Medtronic Guardian 3 system has to be inserted every 7 days. These are kind of short-term solutions, and they involve reinsertions for 7, 10, 14 days. The Senseonics Eversense system is a 90-day surgical implant. They also already have CE approval in Europe for a 180-day implant, and the FDA application has been filed for the 180-day implant in America. It is worth noting, though, that the Dexcom G6 is FDA approved for ages 2 and up, so it could be used for children. The Abbott Freestyle Libre is FDA approved for 18 and up. The Medtronic Guardian is FDA approved for ages 3 and up. So the Medtronic and the Dexcom products can be used by children, but the Abbott Freestyle and the Senseonics Eversense can only be used by adults. These products are also very expensive. The Dexcom G6 subscription costs $300 a month. It is covered by Medicare, but still $300 a month. The Abbott Freestyle Libre costs between $40 and $75 per month, and it's also covered by Medicare. The Guardian from Medtronics costs a lot more, $750, and it's not covered by Medicare. The Medtronics and the Dexcom products are able to be used by children, whereas the Abbott and the Senseonics product cannot be. And this is one thing that I actually don't like about Senseonics. Their product, I feel, needs to eventually be approved for children. I'm keeping it real here. It's not all rosy. Every company does have problems. The reason is the market is increasing over time, with children being projected as one of the most lucrative segments. To be fair, the CGM monitoring systems market, the sensors are the most lucrative portion, along with transmitters and receivers, not insulin pumps. The fact that the Senseonics Eversense product doesn't have an insulin pump associated with it doesn't actually matter that much financially. Just the sensor and the receiver are the most lucrative parts. Now, this is an article from Healthline about Medicare moving to cover all brands of continuous glucose monitors. To date, all CGM devices on the market, with the exception of the Medtronic system, are already covered by Medicare, including the Dexcom, the Abbott Freestyle, and the Eversense. Now, this isn't the biggest deal because the only one that's not covered currently by Medicare is the Medtronic system. But what this actually does is it shows you that CGM is an important, relevant market, and Medicare is willing to issue a blanket future statement saying that they're going to cover all CGM products. This is kind of a vote of confidence in the necessity of CGMs. This is the actual product right here, the Eversense. So this is the sensor that's going to be implanted into the skin through a outpatient surgery, just an incision. This is a transmitter that's attached above the sensor on the top of the skin, and then there's a mobile app on your phone. So like I said earlier, the FDA has already approved the first CGM system with fully implantable glucose sensor and compatible mobile app for adults with diabetes. The current FDA approval is for the 90-day device. Works for both type 1 and type 2 diabetes. The sensor is coated with a fluorescent chemical which, when exposed to blood sugar, produces a small amount of light that's measured by the sensor. Every 5 minutes, measurements are sent to compatible mobile device, your phone. And this was kind of huge. For the FDA Advisory Committee, the vote to approve the product was an 8-0 vote. The committee was unanimous in its recommendation that the benefits outweigh the risks. The potential risks are related to the insertion of the surgical procedure, the removal, and the wear of the sensor. The committee was unanimous in its vote saying the benefits outweighed the risks. I'm not saying there's no risks with the project. Anytime you have a surgery, no matter how small, there are risks associated, particularly with infection. But when the FDA committee is even giving a unanimous vote of support, that's a pretty good vote of confidence right there in the product's need and efficacy. So what happened with this company? Why did their shares never recover? Why do they have such a low valuation despite having FDA approval for their product? Really great questions. They had to halt their sales in the wake of the pandemic. This is an article back from March 31st. At this time, this was after FDA approval was already granted for the 90-day sensor, the company had to lay off half their workforce, retaining only researchers, QC experts, and a few salespeople. The company went into hibernation. They were servicing existing customers using the product, but they weren't accepting new customers. Why did this happen? It happened right after they closed the deal with Medicare, but their investors got nervous because of the pandemic and the fact that Senseonics was still in its early stages. The investors called in $50 million worth of debt, and the company couldn't default on the loan and just had to pay it and then cut all operation expenses. The meltdown happened over a 1-week period, and we didn't have a big enough runway to get a strategic place. They couldn't jeopardize the whole company, so they just shuttered their operations until they could get more funding. One of the things that they ended up doing during this period of being shuttered is to improve the procedures. The company began training dermatologists, general surgeons, and gynecologists, doctors that are already proceduralists, whose offices are already geared towards having a sterile field. There's enthusiasm, and the patient cost is about $250 for a single insertion or removal, and about $350 for a bundled package. So right there, you can actually see, even with the 90-day product, at those prices, this is a cheaper product than any of the competitors. Now, how did they come out of hibernation? They ended up reaching an agreement with Ascensia, which is a Switzerland-based diabetes company that was an offshoot of Bayer. Ascensia is the largest diabetes treatment company in the world, and they're a global company. This is a massive partnership that's going to provide financial stability for Eversense. Right away, the Ascensia agreement provides the company with a financial stimulus of $35 million and another $15 million once the Eversense XL product gets FDA approval, which should be coming this summer. Previously, Eversense had a partnership with Roche. Roche is another Swiss-based company, but Roche is not specialized in diabetes. These are all of Roche's products. Listing all the way down, you could see it's just general pharmaceuticals, cystic fibrosis, breast cancer, pain management, heart attacks. Diabetes is just one part of what Roche does. Senseonics announces a strategic collaboration with Ascensia. They entered into the financing agreements, like I just said, and this is going to allow them to focus on streamlined operations on manufacturing, research, and development of the next-gen Eversense systems. That's the backstory. Let's get into my 4 questions before I invest in a company. Who's in charge? What's the product? What are the financials? And who else is involved? Who's in charge? This is actually incredibly impressive. If we take a look, their president and CEO is Tim Goodnow, and previously he was the vice president of technical operations at Abbott Diabetes Care. Abbott, if you remember, is one of the main competitors of Senseonics. This is their COO, Mukul Jain, and Mukul spent 13 years at Medtronic working on active implantable devices. So he was an implant expert at one of the other competitors, Medtronic. Francine Kaufman is the CMO, the Chief Medical Officer, and she's one of the world's leading endocrinologists. She's spent 40 years in diabetes care. She has a lot of publications, 250 manuscripts and numerous books about diabetes, obesity. She's an expert in the field. Their vice president, he's responsible for engineering and R&D, Abhi Chavan. Abhi had several leadership roles at Medtronics, again, another competitor. Their vice president, GM of Global Commercial Operations, Mirasol Penlilio, I hope I said that right. She actually was affiliated with Abbott Diabetes Care previously for commercialization of the Freestyle Navigator. So you can see all of their executives have vast experience in this field already, often working at the competitors of Senseonics. Now, I also think it's worth noting that when you're talking about who's in charge, we talk about Ascensia. Ascensia is effectively funding Senseonics, so we need to look at their reason for doing so and their influence. Ascensia is a leader in blood glucose monitoring systems with almost 80 years of innovative diabetes care products. Their products are sold in 125 countries and help 10 million people worldwide every day. If you go to Ascensia's website, this is their alliances, their partnership page. If you go to CGM, they only have one CGM partner, Senseonics, right here. That's it. So any place that Ascensia works, they're going to be pushing the Senseonics CGM. They do work with Medtronic for the insulin delivery system because the Senseonics product is not an insulin delivery system, but Ascensia is going to be pushing the Senseonics CGM and the Medtronic insulin delivery system. Question number 2. What's the product? Now, we already looked at the product page. I thought it would be fun to look at a user article. This lady wrote up an article about her firsthand experience with the system. This is what it looks like. You have the transmitter taped to the skin and the implant is underneath the transmitter. This is the package. You have a charger, you have the product. This is a picture of the insertion process. So you can see this is about the size of the sensor and it's implanted underneath the skin. The person mentions the insertion itself was fast and mostly painless. There was a local anesthetic, no bruising, but there is a little scar. Previously, she used Dexcom, and some of the main differences are that the Eversense transmitter vibrates, but the Dexcom sensor makes audible noises. So this is actually more discreet, the Senseonics product. The Senseonics product needs to be charged about 15 minutes a day, and there's no need to carry inserters, and the adhesive is always fresh because you put on a new one. You do have to calibrate the Senseonics product twice a day with finger pricks, whereas you do not have to calibrate the Dexcom or the Abbott products. But the flip side is that Dexcom, the Abbott, the Medtronic products are all anchored into the skin with a needle and it restricts range of motion of the patient and they feel the skin pulling. Whereas the implant from Senseonics is not going to have those issues. So it's like a trade-off. With Senseonics, you have to deal with the 2 finger pricks a day, but you don't have the constant pulling of the skin anchored product. One other thing, I know this is silly, but there's a company that's selling decorative skins for the Eversense transmitter, Pump Peels, and this lady ended up getting a little skin for her black transmitter. I just thought that was cute. It just reminded me of getting a phone case for your phone. So here she talks about some of the pros and cons. The best way to summarize this is that she loves the convenience. The disadvantages, she thought that removing the transmitter every day was a little bit of a pain to charge for 15 minutes, and you have to wear the adhesive in the same spot for 3 months. Skin irritation from the FDA results was a minimum, so that's not really a big deal. She thinks it's really great to be free of ongoing insertions and audible alarms. The ongoing insertion would be the needle anchor from the other products. Now, this is an older article. This is from 2017, and this is about the CE approval in Europe. The most interesting thing that I found here is the adoption. 80% of the people who went into Eversense for the first time previously wore other CGMs. So only 20% were new patients. 80% were using other products like the Dexcom, like the Abbott, like the Medtronic, and they wanted to try something new. This is actually a really nice indicator for adoption. I briefly want to touch on the marketing aspects of this, specifically the CNFU theory of marketing, which is the customer's need for uniqueness. People tend to want something unique. They want a new product. They want something new. They want to stand out. Shocker, diabetics are people too. There's a tendency in marketing for people to be drawn towards something novel. That's why innovation is a huge deal. deal. The Senseonics Eversense CGM system is totally different from the skin-anchored systems of its three primary competitors. People are drawn to that uniqueness and they're willing to try it out. But uniqueness is important because otherwise your product is relegated to commodity. To stand out from everyone, you must show your audience some uniqueness. This uniqueness can come from one of two areas: your brand story or your position. Eversense Senseonics has a unique brand story and it has a unique position/product. From a marketing standpoint, this product is excellent. Now, this is from the Eversense website. These are benefits of using their own product. These are statistics from their customers. No other CGM system gives you this much wear time. It's accurate. Within 15 minutes, it can accurately detect 96% of hypoglycemic events, 98% of hyperglycemic events, only 4 sensor changes per year. When that goes to 180 days, then it's going to drop to 2 per year. Say goodbye to frequent and painful self-insertions. That's the needle anchor of the competitors. Vibrating alerts, and this is kind of just feedback from their customers. 86% reported less day-to-day burden, and that's considering the need for the 2 finger prick calibrations. 85% reported improved confidence and control of their glucose levels. 80% were more motivated to keep up with diabetes management. We talked earlier about how diabetes management is a great way to curb diabetes 2 and even reverse it. 84% would choose to be inserted again. So we already saw that there's adoption increases of new customers that previously used a competitor's product. And here we have an overwhelming percentage of users who want to do it again. They want it again. They want the product reinserted for another 90 days. Right now in the pipeline, Senseonics is still developing ways to improve this product. They're working on a 365-day sensor with once-a-week calibration and additional innovative features. They already have the FDA application in for the 180-day product, but this 365-day product would be groundbreaking, not just because it's a once-a-year insertion, but also because it's going to require once-weekly calibration. That's really the only knock on the product, other than the surgery, the fact that you need to stick your skin twice a day for calibration. If they can get this down to 1 week, this 365-day product is huge. Already the 180-day product is going to be a big upgrade from the 90-day. If you think about it, most people go to the dentist twice a year. That's something we hate doing, but we deal with it. People with diabetes, going up to a 180-day product, that's twice a year insertion removals. They're not going to like it, but they deal with it. For increased convenience, it's a small price to pay. This is about their application for their 180-day system to the FDA. The application was filed on September 30th. And on the application, they're saying that they can reduce the calibration down to once per day. This is actually going to be really big because right now it's still twice per day, but they think they've increased the accuracy and it might be able to go down to once per day in this FDA filing. So we'll see. This could be a really huge thing too. Now, this was an update from the FDA. It's still waiting on the approval from the FDA. This is as of this week, January. But its application approval was delayed due to the current focus from the FDA on products related to the pandemic, to the coronavirus. Even so, the company said earlier this week that it expects the application to be approved by the end of Q2 2021. So we're looking at a June or July approval. Question 3. What are the financials of the company? Right here, you can see it's trading at about $1.58 a share. Q2 earnings, they actually had a beat, and this is before their operations were shuttered. And then, of course, they were negative, and the next earnings report is what we're going to actually look at here. Now, this is on their Q3 earnings. So they reinitiated Eversense new patient sales and marketing on October 1st. They submitted the 180-day application. Continued efforts to expand patient access resulted in positive coverage decisions representing 80% of covered lives in the US, including Medicare and other insurance companies. They generated a Q3 revenue of $767,000, driven by increased sensor reinsertions and supply orders from existing patients compared to the Q2. They actually started getting revenue from new insertions. Old patients were still submitting supply orders. They reduced their operating expenses and they opened up a line of credit. In December, this was on Christmas Eve, and they actually had a massive price jump here because they released a business update that was incredible. We knew their insertions were increasing from the Q3 earning report, but Q4 net revenue is expected to be approximately $3.5 million, increased from the prior expectation of $2.5 million. They increased their Q4 revenue target by 40% voluntarily. This isn't an analyst coming in. This is the company increasing their own target by 40%. Usually companies undershoot their target, so this means they're probably going to be above the target for a beat. Then they mentioned the delay for 60 days for the FDA, which we already talked about. out. Their full year net revenue is expected to be between 12 and 15 million based on their installed base and acceleration of commercial activities. This is an increase off their previous projection. Roche sales conclude on January 31st, so Ascensia is going to be taking over international sales at that point. They've had strong sales in Europe, and the initial sales through Ascensia in the US were really good too. On Simply Wall Street, they're rating them with a high future and high health financial health. It's important to note that the company does have a massive amount of debt, but with Big Brother Ascensia, I don't really think this actually matters. The reason that I say that is Ascensia is already funding them, and Ascensia is not partnered with any other CGM product. I feel like if Senseonics runs into more financial problems, Ascensia is going to continue to bail them out. You can see we had this big run up on Thursday and Friday of last week, and we're still kind of holding. Shares outstanding, 236 million. Float is only 119. There's actually really high institutional and insider ownership in this company. The short ratio is 3%, which is not really that high. I went to the SEC page, took a look at some of the insider holdings. Their CEO is getting a decent compensation package with shares, but this isn't really like a super concerning number. Also, there was a little bit of news from January 7th that they're granting equity to employees under the inducement plan. This is for its new directors. Just to clear this up, this is pretty normal. They are paying their directors, and you can find that information on the SEC Edgar page here. These are the directors that are getting paid in shares. Question 4, who else is involved? If you go to Yahoo Finance, look at the other holders, you could see some big names here. Delphi Management, Vanguard, BlackRock, Millennium, Geode, T. Rowe Price, Raymond James, Fidelity, Schwab, iShares. There's a lot of big name holders in this company. So what's the takeaway? What's the play here? I think this company has a novel product that's easily marketable. They have financial backing through Ascensia that's going to be able to market this product specifically to people who would be purchasing diabetes product. Ascensia has an exclusive CGM contract with Senseonics Eversense, so it's the only product they're going to be pushing. Of course, with any other penny stock, this is a risk, but in this case, this is a risk I'm willing to take. Now, I showed you guys before that my average cost basis was 92.5 cents. I'm going to go ahead and show you again on my Robinhood as of today. You guys can see that I still have the same shares that I purchased last Thursday, and I didn't scalp any profits. That way nobody can accuse me of a pump and dump here. I ended up getting in at SENS at 92 cents. And I posted about this on my YouTube community page because I knew I couldn't get my video up in time, but this is also up pretty significantly. I'm very happy about this. So there's my position. I'm planning on holding these blindly until June or July when we get the FDA approval. There should be a small PR catalyst at the end of this month when PR is released about ending the partnership with Roche formally internationally on January 31st and Ascensia taking over sole marketing of the product internationally. The short-term price movements of this product are not going to influence me at all because, like I said, I'm just going to be holding this blindly until the FDA decision is released in June or July. At that point, I'll reassess and decide what I want to do with it. Part of the FDA decision is going to be whether or not the product can be calibrated with only one finger prick per day instead of two. That's going to be something that's worth watching out for. Also, I'm very interested to see if this company can get the product approved for children under the age of 18. But I'm not very optimistic about that because it is a surgical procedure, and typically we don't want to expose children to unnecessary surgical procedures. That's not really something I want to hold out hope for, but also that's not a deal breaker for me. In the future, the pipeline includes a 365-day option for this with once-a-week calibration. That'll be absolutely massive, and they have been working on that product for years now. So we might get an announcement on that within a couple years. So you guys see where I stand on the company. I do think this is a strong buy. It's got a necessary market, and I'm confident holding these shares. I know this was a little longer. I hope you guys enjoyed it though, and I thought all the information was necessary to kind of build the case for SENS. If you did enjoy the video, please like the video, subscribe to the channel, and if you want access to my content as soon as it goes live, make sure you hit that alarm bell. Also, if you're new to investing, go ahead and check out my Robinhood and my Webull account referral links below the video. If you sign up using those links and fund your account, you get some free stock, I get some free stock, everybody's happy. Thanks so much, guys. I appreciate all your feedback. See you again real soon.